Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and we're going to continue our discussion about mid-face rejuvenation and fillers. So this is a 50-year-old patient, and this is a great example of what we see in early aging. This patient has great skin, does not have a lot of baggy tissue, just starting to experience the changes that we see at a half of a century. And basically, you can see she has a little notch right here. And if you go like this, it pops it out. This is very important. So from there to there is youth. I want to show you again. We have a trough there. When I push on it, it pops that out. We're not talking about a lot of volume here. We're talking about just even sometimes drops of filler going from there to there to there. I know I'm beating that into the ground, but there to there is rejuvenation. Young people have roundness in volume here. Look at your high school picture. That's how your cheeks were. As we age, we start to decrease, and then we become very drawn here. So for rejuvenating this area, what we want to do in this particular patient is just build this back up. And this is the cheek trough region, and we're going to go from there to there. That's one of my favorite little terms, and we talk about it all day long because a lot of people don't realize that these small changes can improve their mid-face volume and make them younger by going from there, you guessed it, to there. So we're going to put a little filler in this patient. All right, so we're going to put a little filler in this region that we had previously outlined. We injected a little bit of 2% xylocaine, 1 to 100,000 in this region. I always numb my patients. I never inject anybody without numbing them. And our goal here is a multiplanar injection where we have a little bit of deep and a little bit more superficial and run a little bit right up into the tear trough. And we'll walk that over, put a little bit of Vaseline on there. And what we're doing is adding nice roundness to this area. And we're going from there to there, so to speak. Now, you could do a similar thing with a cheek implant. In this particular case, this patient doesn't really have quite enough volume loss for cheek implants. She still has pretty good cheek, but she has this proverbial depression and cheek trough that patients get. And so the other thing that we're going to do here is we want our light reflex to be right about here, and that's the area of the maximum projection. So our goal is to just give a nice youthful cheek contour, and I'll probably add just a little bit right here and maybe into the tear trough a bit, and then backing out to this area. And so what we've done is we've taken our dent there and we filled it to a nice, youthful, more rounded contour. She's red from the injections and the massage, and she is a little white here from the local anesthetic. But you can see how we have this nice, what I call a cheek apple, because it's just that roundness there. And if you remember, we had the big groove right here. So this is exactly what we want, and this is why fillers are so powerful there. Cheek implants can provide the same type of power, but this particular patient was just did not have enough volume loss for cheek implants. So this is Dr. Joe Niamtu, LoveThatFace.com. Thank you for watching me have fun.